Saphenous nerve. The saphenous nerve is the largest and longest branch of the femoral nerve. It supplies the skin and the inside of the leg.
The saphenous nerve block is a single nerve block that can be performed at the level of the knee or at the level of the ankle. Here we present the block at both locations. It is important to recognize that the saphenous block is often performed as a supplement to the popliteal block or ankle block. As illustrated in the figure, the anterior cutaneous nerve distribution in the lower leg includes the lateral cutaneous nerve, the saphenous nerve, and the superficial and deep peroneal nerves, which are branches of the common peroneal nerve. Thus, an isolated saphenous nerve block provides patchy regional anesthesia when performed alone. Prior to initiating the saphenous nerve block, obtain a tuberculin syringe with 1/2-inch 25-gauge needle, 1% lidocaine, a 10 milliliter syringe with 1.5-inch 22-gauge needle, 10 milliliters of the local anesthetic of your choice, gauze, and a povidone iodine swab. The saphenous block may be indicated for surgery on the lower leg when combined with the popliteal block. Together, the two blocks anesthetize the saphenous, popliteal, common, and superficial peroneal nerves. The patient should lie in the supine position on the table with the leg and foot flat. Pelvic side of the knee posterior to the sartorius muscle. Palpate the tibial tubercle, the bony prominence 2 to 3 centimeters inferior to the patella. This will be the point of needle insertion. Prep the area where the needle is to be inserted. Start at the tibial tuberosity and proceed linearly toward the tibial condyle. Repeat the prep 3 times, allowing the prep solution to dry before needle insertion. Using a tuberculin syringe and attached 25-gauge needle, create a wheal with 1% lidocaine in the cutaneous tissue over the tibial tuberosity.
Clinical significance. Procedures such as saphenous vein cut down can result in damage to the saphenous nerve, resulting in loss of cutaneous sensation in the medial leg. This is due to the intimate path that the saphenous nerve and the great saphenous vein travel. Function. The saphenous nerve above the middle of the thigh gives off a branch which joins the subaortic plexus. At the medial side of the knee, it gives off a large infrapatellar branch, which rises the sartorius and fascia lata, and it distributes to the skin in front of the patella. Saphenous nerve entrapment neuropathy. Saphenous nerve neuropathy is an important consideration in the differential diagnosis of lumbar radiculopathy, medial knee pain, and lower extremity vascular insufficiency. The saphenous nerve is the largest cutaneous branch of the femoral nerve and is purely sensory, which branch of the L3 and L4 nerve root levers contribute to the nerve.
What? Alright, where did you sleep 2 nights ago, Craig?
In the hospital.
Which hospital?
The University of Michigan.
At the emergency room, right? And how long has it been that you've been injured?
3 months.
Yep, 3 months and 2 days. And what happened to you yesterday?
I got 2 shots.
Yep, a saphenous nerve block, correct? And how does your pain feel right now? On a scale of 1 to 10.
1.
About a 1, all right. Can you take your leg off the pillow and scooch to the edge of the bed for us? All right. Now don't move real fast. We don't want to rush anything. We're going to get this on tape. So put your foot to the ground and just gently put a little pressure on it, not a lot. All right, so you can touch it. Can you wiggle your toes into the carpet? And how does that feel?
Hurts.
A little bit?
Yeah.
Scale 1 to 10.
Still a 1.
Okay. Can you touch your knee and your foot with your hand? Raise your foot up. Raise it up, like cross the other foot.
This or
No, yeah, you're there. So touch your hand where it used to really, really hurt, the areas where it's circled. Okay, and gently slide up and down your leg. Now, does that cause a lot of pain, a little pain, or no pain?
a little pain.
A little pain on a scale of 1 to 10?
Still about a 1.
Okay. Can you wiggle your toes and rotate your foot? And you can move your knee.